everyone. This is Stephanie Chuang. I am the founder of The Patient Story. First, I just want to acknowledge that I typically don't do these videos because I don't want to make The Patient Story about my story so much or my voice. It's about everybody's story. But what I realized as there's more subscriptions and more people watching, that I want you to know who we are and the why, why we do this, why the patient story even exists. And that is very much about my own experience with cancer. So bear with me. I don't have a script or anything. I do have some notes, but the goal is just so you can understand more of what this all is. And also as an invitation for you to let me know what we could do better for you as a cancer patient and or caregiver. So first, I was diagnosed with stage 3 non-Hodgkin lymphoma at the very end of 2016. I was 31, 2 months from getting married, and was a TV news reporter here in the San Francisco Bay Area. And I'd been doing that for over a decade. So I get this diagnosis over the phone, bawling, don't know what to do. Long story short, my experience was I really want to hear from somebody else who's already been through this. And it was really hard to find that. And I wanted just something fast, something online. I'd seen patient stories before, but they were super short. And it just didn't feel like I was learning what I wanted to learn. All I wanted in that moment was to see that someone can get through this and understand in human words or language or anything, what cancer meant. And I know that it's a very different experience for so many of us. It depends on the diagnosis. It depends on the stage. It depends on where we are and what kind of support we have. And I understand all that. But the very basic feeling of, okay, it's not just all these statistics. By the way, what I've learned in the last couple of years is that the numbers we're seeing are largely outdated. A lot of what we're reading and saying does not apply to us. I mean, it might, but most of it misses the mark. And that's what I wanted the patient story to be. I wanted it to be a place where people could find these voices, other patients, cancer survivors, cancer caregivers, and really feel seen and heard. And ultimately that I am not alone. You were not alone. And that was the biggest goal. So we have done now hundreds of these in-depth interviews. I don't know if you've had a chance to see some of our older stories. Maybe that's how you found us. But literally it was me talking to somebody else for 60 minutes, 80 minutes, and just putting that right up on the channel. And, no edits, just wanted to get the content up and just to see, does it land with people? And now, since then, I've been really lucky. I have a small group of these video editors who are super passionate too, and who get it. And we're trying to break down these interviews into segments more, so they're more focused on a topic, and putting in things like animations and, more pictures, and hoping that that just is serving people more. But on that note, I really do want to hear from you. What is it that would help you? Long videos, short videos, doesn't matter the length. Don't want to see Stephanie, only want to hear from the patient whose story is being shared. That's all I care about, honestly. And so, the patient story here on YouTube is all these videos. We started with thepatientstory.com. That's where you'll find a lot more of the, the story in writing and pictures and timelines to help people understand, what will my life look like? Because again, the goal is very simple: humanize cancer, and also show more of the median experience, something that's more relatable to people, that it's going to be hard. I'm not trying to sugarcoat that part of it. No matter what the diagnosis is, it's, really hard, but that it's not the doom and gloom necessarily that we're seeing when we Google. So, that's what the patient story mission is. It's to humanize cancer with the ultimate goal of being your friend, or if not a friend, at least sort of, someone had described it as Yoda. And I agree with him, because Yoda is that figure who's wise and also not judgmental, but, is just kind of there and kind of comforting. I hope that's not blasphemous for Star Wars fans, but that's the sense that we're trying to give, is a guide, a friendly guide. The second part of our mission that's really grown in the last year, really year and a half, has been humanizing cancer in a different way. Once the most important thing is hopefully achieved, which is letting people see you are not alone, feeling a sense of calm and comfort, that maybe we can help get to a place together of, okay, I think I can take this next step of being more empowered in my care, right? Empowered in treatment decision making, at least in knowing what your options are and feeling a little bit more in control. And so, in that way, we focused on two things: topics like self advocacy, talking next week with a woman named Nadia, diagnosed with SLL, and it's a chronic form of cancer, and she had to fight to get her diagnosis. So I don't know how many of you can relate to that. Also, topics like biomarker testing, especially in cancers like lung cancer, for instance, how important it is to know what your options are, because those results can really impact your treatment options. And depending on where you go, you may not know that. All the way to clinical trials, which sounds incredibly intimidating because it's clinical is the name in part of the name. But I've learned that, for a lot of people, not everybody, but for the good number of people out there, it could be a better option than the standard treatment, and it may preserve more options for you. A lot of times it's you get sort of a lot of care. I mean, it can be, for some people, it's too much attention, like lots of tests and questionnaires and stuff like that, but you're really under medical supervision. And so that's one aspect of it. And the other is, you might have seen, we've done a lot more doctor interviews, and there's a reason behind that. I think a big part of that in humanizing cancer and understanding it is hearing from doctors in this part of it and understanding treatment options. And in humanizing those conversations, one, we try to pick doctors who are very patient focused. They treat us holistically as people, and not just as the patient. And the second part of that that's really important is trying to take the medical jargon or medicalese out of it, which, of course, they're talking to their peers a lot, but I want to understand in layman's terms what they're talking about. And so I'm hoping that all of this is, helping people. So I didn't mean to talk for this long, but on that note, really, truly, this is always going to be for cancer patients and caregivers. And I want that to be known 100%. So your feedback is really important. So, send me an email, Stephanie@thepatientstory.com. Again, STEPHANIE at thepatientstory.com. I will try my best to get back to you as soon as possible. You can send feedback. Let me know if you want to join our mission. And by the way, we are inundated right now. We are really busy, which is so good. But that also means it's been hard to get to all of your stories. I mean, hundreds of you have volunteered to share your stories, and I feel really honored and privileged that you've done that. I know it takes a lot to get to that point. Please know that, we're really grateful for you and that we do believe your story is important. And thank you for your patience. We're a small team that's growing, and we're working hard to get bigger so we can, invest more in all of your stories that we think are, really important and impactful for people. So I will be saying hi. Also, I think, regularly to let you know what we'll be publishing the following week, so you have a sense of what's to come. And, thank you for finding us. And I hope we're serving you in some way. And please be kind to yourself. We are all doing, I think, the best that we can. So give yourself some grace. And till next time, take care.